Ruth Steinberger is going to talk about how to recruit veterinarians. Ruth has coordinated rural pet sterilization programs since 1993, assisting at-risk animals through spay, neuter, education, and improved public statutes. Ruth moved to Oklahoma in 1999 to reside in an area with no existing low-income spay-neuter programs and has worked closely with volunteer networks, veterinarians, humane organizations, tribes, and municipalities to develop services for animals in communities facing chronic poverty. She was a founding board member of the Tulsa-based SPAY Oklahoma, and in 2006, in recognition of her work on tribal lands, she received the prestigious ASPCA Henry Bergh Award for Animal Activism. In 2010, recognizing the unique challenges facing chronically impoverished regions, Ruth founded SPAY First. Since its inception, the organization has become a leader in the research and development of non-surgical fertility control products for free-roaming dogs, and as of 2020, cats as well. Ruth was a presenter at the 2012 World Health Organization's first international conference on dog population management, the SPAY USA South Regional Leadership Conferences 2004 through 2009, the 2007 Humane Society of the United States Expo, and 2011 through 2013 Best Friends Animal Society's No More Homeless Pets conferences. As an activist and journalist, 6 of Ruth's blogs, all focus on companion animal overpopulation, were published on Huffington Post. In 2012, Ruth was awarded honorary lifetime membership in the Oklahoma Veterinary Medical Association. Ruth was also the sole non-veterinarian to contribute a chapter to High Quality, High Volume Spay and Neuter and Other Shelter Surgeries. That was edited by Dr. Sarah White and published by Wiley Blackwell in 2020. And I'm sure we are all extremely eager and excited to hear about how to recruit veterinarians.
Thank you so much. And those were great presentations. The last hour was just fascinating. We're going to talk about hiring veterinarians today and also recruiting overall in primarily rural communities, which face their own challenges. This presentation was created with assistance from Charles Halwig, DVM. He's the former executive director of Oklahoma Veterinary Medical Association, the former executive director of Southwest Veterinary Symposium, which is the largest veterinary conference in the Southwest, and he's a founding board member of SPAY First. And a warm thank you for reviewing this presentation to Wendy Howard, a high volume, high quality veterinarian, mom of a 15-year-old who rescues homeless kittens, and whose dedication to spay neuter is truly making a difference throughout Oklahoma because she's willing to mentor other veterinarians. And the presentation is for state leaders in the United Spay Alliance, organizations planning to open a spay neuter clinic or run mobile programs in rural areas primarily. We've had some great information on urban spay neuter programs. Animal advocates seeking to create a subsidy program in partnership with private practices, for example, for cats or low-income homes, and those who need to develop services and are really not sure of where to begin. Kind of the apex of your program, because without your surgeon, you do not have a spay-neuter program. Yet we often fail to view ourselves as providing a service that requires good communication with veterinarians, the veterinary community in our state overall, and with a strategy for growth. Veterinarian to veterinarian communication is truly key to growth. And if you think about it, there's no field of, no other specialty field in veterinary medicine, for example, orthopedics, or veterinary oncology, in which lay people would be put in a position of all of the hiring and explaining the programs, designing the programs. And so we need veterinarians to communicate on behalf of our programs, about our programs, and certainly for training to make our programs robust. Low-income households have long been documented to produce the overwhelming number of unwanted litters, and anyone who would like to email me can do so, and I'll send you these links. But it's been shown that as that household income diminishes, the likelihood of intact pets, especially cats, increases. And that was first published in 2009, but a follow-up article in 2018 in JAVMA noted that 53% of homes using low-cost programs actually have household incomes under $30,000 annually. So what that means is that you, by your location, by your outreach, you likely are providing a low-income program, and that's important. A program that's not income targeted will simply have significantly diminished support from the veterinary community. In an urban area, that may not affect you. You may be able to hire, you may be able to move forward. But this is particularly the case from private practitioners that are needed for participation in subsidy programs, and certainly in rural areas. A program that's not income targeted will likely have no support or cooperation from the Veterinary Medical Association in the state. And going back to our startup slide, Chuck Helwig, Dr. Helwig was executive director of Oklahoma Veterinary Medical Association, and under his leadership with Dr. John Otto, they were the lobbying force that got us a spay-neuter license plate and tax checkoff. So their participation has been truly vital. And needs vary widely from one geography to the next. A high volume program will not sustain, obviously, in an area with very low population density. Here in Oklahoma, we have areas that have less than 3 people per square mile. And as you go north, in the middle third of this country, that's not uncommon. 37% of the nation live in unincorporated rural areas, and 76% of the nearly 20,000 incorporated towns and cities have fewer than 5,000 people in the city, and 42% of cities and towns, incorporated cities and towns, have fewer than 500 people. So for those who are serving low population density, which generally translates to also lower income, at least some support from the local veterinary community is pretty helpful, if not completely vital. So there's no easy solution. There's a shortage of vets. And I am having a problem seeing my screen. So reaching out to the veterinary community to increase your network before you need to hire, being knowledgeable, creative, and having your needs well defined will help you fill vacant positions and be able to grow new programs. Including a spay-neuter veterinarian in an advisory role is very helpful. If possible, a spay-neuter veterinarian being on your board, being available for direct communication with prospective veterinarians who inquire about an open position, that's very, very helpful. Define your needs. So are you looking for a clinic to provide subsidized services? And it says pet food subsidies here, and that is not the aim, but what we're talking about here is subsidized services, which are services that have a reduced cost with the clinic. A small portion is paid by the client, and a subsidy augments the rest. So there's a pre-agreed upon rate with that veterinary clinic, and the programs that are augmented may be pet food, they may be spay-neuter in our case, and even other veterinary services. Or are you looking for a full or part-time veterinarian for a spay-neuter clinic or mobile program? If you're in a rural area, but you have towns that have a level of population that may sustain a program 8 days a month or even 6 days a month, we have a program on the Spay First website called Mini Clinics, and that's helpful in helping you develop a program that has a sustainable budget, and it's a smaller service. But are you asking a veterinarian to provide those services, and how will you reach them in that area? Assistance in expanding a statewide network, which is a combination of services, including spay-neuter clinics, mobiles, subsidized partnerships with full-service clinics. And know the community and the area, the region that you're serving, and be able to describe the needs. Census.gov is still a great place to understand if you are serving a community that has 5,000 people per square mile or 5 people per square mile, because those stats really define your needs. They define your program, along with income levels and how far to the north and south you are, if there's animal control ordinances that help define how many litters may be produced. Are there leash laws in particular? So running ads. The AVMA posting is expensive, but it reaches hundreds of links. Your veterinary examiners board, which is the regulatory board, will have a list of licensed veterinarians, and you can contact relief veterinarians through that list. And you may be able to get someone who has time to help you 1 day a week, 2 days a week. And again, if you go back to an earlier slide, if you have a veterinarian who's willing to train that person in high volume techniques, then that person may be able to help you in a mini clinic, mobile program, or any of the programs we've talked about. Contact your state veterinary medical association to place an ad. Ask if it's possible for them to post your job on a membership listserv. And be clear about the number of surgeries that are your goal. Be sure that number and your goal are reasonable and doable, because for a veterinarian reading your ad needs to really make sense. 35 surgeries obviously doesn't mean 35 female dogs. The Veterinary Examiners Board and the Veterinary Medical Association are not the same thing. If you are opening multiple programs, if you're part of the United Spay Alliance team and you're looking at private practices to have partnerships, but you're also looking at opening clinics, that examiners board is an important place for you to start. You need to have a rapport with them. So ads continued. If a veterinarian in your network is willing to train a new veterinarian in techniques that are typically used in high volume surgeries, for example, pedicle ties, where to locate the incision to keep a smaller incision, include that opportunity in your ad. You'll be paying for the time of the veterinarian who's doing the training if they're not volunteering, and that needs to be in the ad as well. But making it clear in the ad, we will support you as you move into higher volume and meeting our needs. Include information about the support team that will be working with the surgeon, i.e. their level of experience and qualifications. A well-trained, experienced, and consistent team matters to most surgeons. If you don't have a great and welcoming team, that's an issue to address. Figure out why, and it's difficult to hire a team when you don't have the veterinarian. So these things have some moving pieces, but again, most surgeons want to know that they're going to have a good team and that it's a consistent team, not someone different on different days. Include pertinent information about your program and the location. For example, if you're in a rural area that's probably unfamiliar to most people, include the distance to larger cities or even to landmarks so that a possible job seeker can put your location into context. State your mission. Low-income households, stopping suffering. Make sure to make it clear that you're mission-based and that you want them to be a part of a team that's doing good work. We've found that having a 4-day work week is significant to most veterinarians in terms of looking at these jobs having a benefit. The 3-day weekend is a benefit. And make it clear that this is high quality, high volume. Networking. Elevate your program in order to be relevant to a larger portion of the veterinary community. Again, we are doing more than hiring one person at a time. We are trying to change pet care habits. We need the involvement of a professional community that is required for every single thing we do in order to be a part of that story. Veterinary conferences are a great way to meet new veterinarians who may be interested in spay-neuter programs. These are a relaxed setting and they enable discussion, they enable dialogue. Sponsor a veterinary spay-neuter continuing ed speaker or a wet lab at your state veterinary medical association meeting. This will probably take a couple of years to plan because the conferences are planned a couple of years in advance, but it is a great way for veterinarians who are passionate and knowledgeable about these programs and about the techniques to reach and communicate with other veterinarians. So you can contact shelter medicine programs at a nearby teaching college to get available speakers. Dr. Brenda Griffin has traveled to Oklahoma, I think 3 times. Dr. Phil Bushby came here, and their presentations riveted the room at these conferences. Holding a spay-neuter hors d'oeuvres or even coffee and snacks at your state veterinary conference, again, with practicing high-volume, high-quality veterinarians, that makes them able to speak with veterinarians already in this field, again, in a relaxed atmosphere. If a speaker will be in town presenting at the conference, make sure they're at the meet and greet. Invite funders if possible. Conversation is veterinarian to veterinarian, which actually gives you time to peruse the food. This is absolutely not the same as having a vendor table at a conference, which makes you in a space in which you are seen as someone selling something rather, and you're also representing veterinary information as a non-veterinarian. So that's not a terribly effective thing to do, but bringing in veterinarians, having a relaxed atmosphere, being a part of the continuing ed makes your programs relevant in a bigger way. So this was several years ago, but Dr. Brenda Griffin, seen in the left-hand slide, was in. She spent a couple days with us, a few days actually. She's standing with the Dean of the Veterinary College at the time, Michael Lorenz. We invited the veterinary board, the board of the regulatory board. We had invited the OVMA membership. And so what happened was that event became kind of a who's who of the veterinary community. A lot of private practitioners came. As you can see, the dean was there. The executive director of the veterinary regulatory board was there. And it really brought the conversation about spay-neuter into a limelight that it doesn't generally enjoy and that it needs to enjoy. So developing a partnership with private practice clinics. I'm going to start with the second one down, subsidized surgeries. Again, these are subsidies that are raised, license plate checkoffs, pet food surcharge. Generally, these are a reduced cost from their regular cost. A portion of it is paid by the client and the rest is subsidized through this fund. These are the least financially rewarding for the private practitioner. If you do not need high numbers of surgeries, if you're in an area that's relatively well off, and at one point, statistics from New Hampshire said that communities, in order to make a difference in shelter intakes, needed 5 surgeries per 1,000 people. That's very, very low. And so subsidized surgeries in a private practice would very likely be all that's needed in an area like that. In-clinic clinics are a part of a day that is set aside for surgeries, but does not reduce their regular price during the regular working hours. And to come back to that stat of 5 surgeries per 1,000 people, we found in some chronically low-income rural communities, those numbers are closer to 25 surgeries per 100 people when you're including outdoor cats and free roaming in a community that are fed. So obviously in a community like that, subsidized surgeries where you're coming up with a significant portion of funds per surgery, and the veterinarian is also taking a loss per surgery potentially, that's not going to expand to meet the needs unless an awful lot of money is being raised. So in-clinic clinics operate by a veterinarian basically using a time block in which they are not doing other surgeries, and they either can put time together that they have a little bit of downtime on Thursday afternoons and a little bit here and a little bit there, but they put all of it together into a 4-hour block, and they schedule that block for a reduced cost, low income program, and they do this without blocking any of the surgeries they would regularly be doing. They're not taking a net loss on the number of surgeries that their clinic would perform, or a combination of these two may be what you're needing to get in cats or a limited number of dogs. So as you're speaking with a private practitioner about working with them on a spay-neuter program, and these are difficult programs, but the more prepared you are, the more likely you are to succeed. Understand the impact to the clinic. So reduced cost, subsidized surgeries during the regular workday generally are the least financially rewarding to the practice. They can very easily be a loss, and they're very difficult to expand. Even if they are just breaking even, to lose more time from regularly scheduled clients is a problem for many, if not most, clinics. Set aside of half day or a day on a weekend can be profitable, even at a low cost, but it requires significant organization by the Humane organization. And for more information on private practice partnerships, you can email us at info@spayfirst.org. But I think everyone remembers this cartoon. The person is speaking, and in this case, the dog is not really hearing, and they're kind of two ships passing in the night. Know what you're asking for. Having an animal advocate who doesn't understand what they're really seeking, speak with a veterinarian who doesn't really understand what they're being asked for, can be a really frustrating waste of everybody's time. And both of them want to do good. Both of them want to be helping animals, helping the community. So be prepared. If you're speaking with a private practitioner, because this is a hiring. This is a form of hiring. This is your program working with a veterinarian to provide spays and neuters. And if you're in a rural, low population density area, this is going to be very likely something that will meet your needs. There's not going to be enough mobile clinics to meet the needs of the thousands of small towns that require spay-neuter access. So be familiar with how programs are typically run and how your proposed program will run. United Spay Alliance is a great place to start, and there were wonderful speakers this morning, and I think any would be happy to mentor you on how a day typically flows. If you hope to operate in partnership with a full service clinic through a subsidized program or through an in-clinic clinic, which is the set aside program of taking a few hours a week, be prepared with a budget. If you're opening a spay-neuter clinic, be familiar with the Veterinary Practice Act in your state before speaking with potential veterinarians. Every state has a practice act, and if you're going to be running a clinic, it needs to be in your lexicon. Practice Acts vary from state to state, and the Practice Act in your state can be found online. And while there are vast differences between cost from one type of drug or suture to another, being familiar with what disposable supplies are used and what their costs are is critical to your discussion. A clinic, a running spay-neuter clinic, can provide you with the prices, though nonprofits do get reduced costs on certain items. And for an info on average cost of supplies, you're welcome to email info@spayfirst.org. Define your ask before you ask. Clearly state your request. Explaining the problems at the local shelter confuses things. Clearly state your request. Re-emphasize you'll be serving low-income households. Include a budget that reflects potential income. For example, asking a private clinic to do 20 cat neuters at $60 each brings $1,200 into the clinic. In a busy practice, that may represent a significant loss. But in a practice with 3 to 4 hours of downtime, or a junior partner who may provide this service on a Saturday or Sunday, 2 clinics a month, totaling 8 hours per month, will bring an additional $28,000 annually into the clinic. Be prepared to discuss logistics in detail and have them in writing. Who will make appointments, provide reminder calls, transport if needed, additional services? Who's going to take the aftercare phone? Possibly your organization can pre-check clients online the night before surgeries, but having all of the details in writing will help make someone comfortable, give them the confidence to try working with you. Be ready to answer questions regarding the pitfalls. For example, prepaying for appointments prevents the clinic from taking a loss for no-shows, because if someone does block out several hours and they have a high no-show rate, they have really just lost money, because they have paid staff to be there, they have prepared for that time. Fundraising to help, to help those who are unable to pay in full. I'm so sorry, I'm having a bit of a problem with my computer. So hiring for a position at a standing clinic, networking, relief veterinarians, advertising, word of mouth through other vets, define responsibilities clearly, surgery, management of the team. Make sure the pay is on target for the number of surgeries. This is salary.com. You can find veterinary salaries. In Oklahoma, the average pay per hour for a full-time veterinarian is between $36 and $59, with median average about $46. Be prepared with a training opportunity. Expanding your connections with the whole veterinary community. It helps you start and expand programs, creates greater awareness of local animal issues among veterinarians, heightens awareness, it builds partnerships, and it builds trust that help animals. And we must have that in the vast swaths of the United States still uncovered by affordable access.
So you touched upon this a little bit at the end. When you're working with veterinarians, relief or staff, what are your thoughts around contracts for them?
Contracts are important, so everybody knows what the expectations are and who's paying for what. So I can email, if anyone wants to, I can email sample contracts with veterinarians. I am sure there's some other programs that also have them, have sample contracts. Humane Alliance, the ASPCA has taken over, but having a contract in place that specifies your expectations and lets them know what their expectations should be, and that also that they can speak about them ahead of time, and preventing misunderstandings is important.
Are vet schools training their students in high volume, high quality spay neuter techniques, or are we still just focusing on just getting them to get some surgery?
If they have a shelter medicine program, that program is going to be teaching them those techniques. And so hopefully you can get people who have done a rotation in shelter medicine. If not, the number of surgeries that they have done may be still pretty limited. And again, oh, go ahead. I'm sorry.
No, you finish the question and then I'll just move on to the next one.
No, again, if you can get an opportunity, if they have not been through a shelter medicine rotation, which we are fortunate to have here in Oklahoma. So veterinarians do come out with more experience and more experience with those techniques. But if not, again, getting a young veterinarian who's out of school, has not been out long, to be mentored by someone who does high volume can be so helpful.
Can you repeat the estimates of the number of spay-neuter surgeries estimated per 1,000 or 100 people and what the parameters are for those estimates? Where is it urban, rural, low income? Do you reference that earlier?
The original data came from New Hampshire with one of the first subsidized programs. And what they found was that that program was solely low income. And they needed 5 surgeries per 1,000 people to make a big difference in the intake of shelter cats. What we have found in low-income communities without a history of the use of veterinary care with outdoor free-roaming animals that they do claim as part of the household, as opposed to community cats. We have found that that number can literally go up to 25 animals per 100 people, because these are people who are feeding animals. There is no access to an animal shelter, and in one community on a reservation, it was actually close to 50 services. And some of that included transport to a shelter in Utah. But it was 50 services per 100 people to get the numbers down. Isn't that shocking?
Well, it just shows how important we have this multi-layered approach of targeted efforts versus offerings for the community at large. So I think there's certainly still a role for targeted work, and then a role for, just almost need blind, but offering sort of across the board for everybody. So I think that's very interesting, depending on what region you're looking at too.
Yeah, absolutely.
Excellent. All right, Ruth. Well, thank you so much.